everyone, and this is the Mama Knows Not a podcast, and I'm excited because I get to do my first in-person interview since I launched this thing. Because, technical difficulties and, pandemic and all that crap. But today we are chatting with Megan from Brooks Rehabilitation Centers here in Northeast Florida. She's going to tell us about all their therapies and programs, as well as special highlight on things that are designed for individuals with special needs. So Megan, thanks for making this happen for me.
Thank you. I appreciate the personal invite. Wow. I feel very, very special in a comfy chair.
Right. You said the queen seat.
I promise I will do it justice.
I have no doubt. So let's learn a little bit more about the Brooks story.
Okay.
How did they come to fruition, and how long have they been serving the community?
So 50 years. We'll go the big 5-0. 50 years ago, Dr. Brooks Brown, that's when Brooks Rehabilitation, which started out as Genesis Rehabilitation, first started. Okay. But if we go back even further, Dr. Brooks Brown was a thoracic surgeon in Jacksonville. So he and his family moved here, and he started working in the medical community, actually founded with some of his fellow colleagues, Memorial Hospital.
Okay.
So they actually started Memorial Hospital. He was a thoracic surgeon working in the community, and it evolved into patients. We needed to do better for patient outcomes and patients' recovery through their journey.
Yeah.
And so that's when we looked at rehabilitation options. And that's where he really said we needed to do more from a continuum perspective, from, prolonging that recovery and improving those outcomes so that it's not just patients who had surgery, just go home. So it really was about improving the care of the patients he was serving, but also in the community of Jacksonville.
Well, yeah. And then if you know what to do at home, your therapy or your procedure, whatever has happened, you might have a better recovery if you can do certain things. And who wants to stay in a hospital?
Well, and hospitals, the hospital stay probably 40, 50 years ago was much different than it is now. For better or for worse, but looking at, yes, if we're having a debilitating or traumatic injury, your world is turned upside down. Totally. So all of a sudden, you're going to need more time to figure out those resources, look at that plan of care, adjust to the differences that really your life is going to entail. And so a rehabilitation hospital is that. It's an extension of that recovery that allows specialists to be able to work with that patient and individual, not only on their initial recovery, but the long-term plan.
Well, yeah, like the day-to-day functionality. Like, how can you do things if you're not in an environment to...
Exactly.
Yeah, that's awesome. Where exactly in Florida are the locations of Brooks?
Yes, so we have our first inpatient rehabilitation hospital is on University and Beach Boulevard. Okay. So that's the OG. That's the mothership. That's where everything started.
The OG.
And so from there, we have branched out. We have just opened a skilled nursing facility called University Crossing, or skilled nursing, pretty much almost the hospital in itself, right next to that. So that's really going to take that, step down care from the inpatient hospital. We just opened our brand new inpatient rehabilitation hospital right off of 95. So everybody sees the big sign across from Baptist South.
Oh, okay.
So that's actually a campus there that our second inpatient rehabilitation hospital is. But that shares space with our aging campus. So there we have what's called the Bartram campus, which has skilled nursing facility, an assisted living facility, and a memory care.
Oh, wow.
So that is that campus. And then we actually have an inpatient unit in a joint venture with Halifax Hospital down in Daytona.
Oh, wow.
So we actually provide inpatient rehabilitation down in Daytona.
Wow. Look at that. I didn't know that. And then... what services do you offer for all populations? We might have a little bit of a guest here. My dog is currently in love with Megan. Hi, Cleo. Okay, are you going to answer this one? Are you going to display which all the answers? What services do you offer? You don't have to list all of them, but just so people know what they're...
So obviously, I'll start with just kind of our skilled facilities. We offer inpatient rehabilitation, outpatient rehabilitation. We offer home health as well.
Oh, so for visits to your home?
Absolutely. So individuals who qualify and can receive those services at home, obviously through insurance as well, home health services. And then we have this branch that's called, and we have outpatient services. So we have inpatient, outpatient, home health. We have our aging campus as well in skilled nursing. But then we have this whole branch, which I like to really kind of highlight because it's unique to Brooks, is our community programs. And that is something that's available to any patient at Brooks, whether you're former or current.
Okay.
And a lot of those services are either reduced cost or free of charge. And it's really to support that long-term recovery for individuals with any disability. So really that community program is the one that should follow individuals throughout their lifespan, depending on what their needs and interests are. So that's unique to Brooks, and that's something I'm very proud of.
Now, I think what intrigued me about Brooks is all the different kinds of therapies you utilize, especially for the disability community, people or anybody who's differently abled or has a special need. Like, you employ so many different types of, therapies. Can you explain a little bit about those ones? Like
Sure.
Music, I think.
Sure. So we obviously will offer the traditional, what we call skilled therapy. So that will be your occupational therapy, your physical therapy, your speech and language therapy. And those we provide in the clinic.
Okay.
Yes, we do have adjunct services that are offered in different communities and in different environments, such as music therapy, recreation therapy. We have dog therapy as well. So Dio, come on and join us. So at the hospital and some of our other campuses, we do, have therapy dogs as well. And then we have really specific facilities and environments that are geared towards either certain interests or certain diagnoses.
Okay.
So for example, we have our adaptive sports and recreation program, and we have our pediatric recreation program. And so that really provides sports and recreation for the lifespan, depending on an individual's interests. But then if we look at very specific to a certain diagnosis, we have our aphasia center, which is for individuals with just aphasia. And then we have our clubhouse, which is for individuals just with a brain injury.
Wow. So
So-
you got all the things.
We try. I mean,
All of the things.
we're exploring, but we realize that there's a huge need. And so a lot of these facilities and a lot of these environments are truly one of a kind or are, national models. So we really try, like the clubhouse is a national model in which to, for vocation rehab, for, social, for just life skills for the brain injury community. The aphasia center is a model that is
so cool.
nationwide. And so we really are looking at trying to get world-class opportunities for individuals, not only when they first are diagnosed or first have their injury, but it's a matter of improving quality of life for as long as they possibly can live.
That's really interesting you say that. There's a woman who I put on a podcast, and her children are individuals with special needs. And part of the reason she moved to Florida was because of the access to care. They lived in middle America, so you could go in any direction and find great hospitals and services. So it's just really kind of perfect that you're saying this. So it's like, oh, well, that's probably why they moved here, because there's certain things that maybe are unique to us.
Well, it makes me very proud that people do want to move here. And we've had patients who have, stayed in our hospital and did some outpatient therapy and then realized going back home to where their, native location was, wherever they were from, there weren't those intensive services. So we have had patients and families move here. That's why we're also rated in, for the military system as, a certain level of care. So military families who, we have a naval station here, when people are, relocated, what ends up happening is if they have a child who is diagnosed or an individual, anybody who's diagnosed with a certain condition, they go to certain level stations that have that care. And so that's what Jacksonville does have. We have a robust amount of care. So we know that those, military families, as they get restationed, Jacksonville's going to be one of those hubs.
Oh, that's really awesome. So how can certain therapies, like a music therapy or an art therapy in particular, be beneficial to an individual with a disability, whether it's, motor skills or like developmental disabilities or like, a mental decline? I don't want to say decline, it's not the right terminology, but like a gap.
An intellectual disability.
There we go. I couldn't think of I know this terminology and I just can't get it out of my mouth right now. How are those services particularly beneficial?
Well, a lot of those services, when we call supplemental, they really are supplemental, but they're really key services because we try to infuse them in what we're trying to do with our skilled therapy. So we're looking at recreation therapy. We're looking at music therapy. We're looking at sports and recreation, as these are daily occupations. These are daily things that people probably enjoy or have enjoyed at some point in their life. So why don't we use those to work on therapeutic skills and to address the deficits or the weaknesses that an individual may have because they're enjoyable, because they can be directly integrated into someone's home environment or home routine. And so when we really look at how are we choosing those therapeutic modalities or what we call therapeutic activities, when we're choosing those, we have to choose those that are customized to an individual, customized to their interest, and making sure that it sticks. Because otherwise, if you're just doing exercises, that's not going to have the carryover and it really can't be integrated back in. And when we're talking about long-term care, we're talking about supporting family members and the families to be able to do this, because just because when they're done with us doesn't necessarily mean their journey is over. And that's the one thing I try to tell families is your journey is going to take lots of different directions. Just because you've reached this destination with this, in this car, you're going to transfer vehicles and go in another one, and you're going to keep on moving. But your journey is never over. And so it's just a matter of what vehicle needs to get you there.
Oh, that's a good analogy, like a nice little picture, because I feel like you can just say that with you can say that with anything, but particularly in parenting, as a first-time mom or a new mom, is the baby hitting a leap? Is the baby hitting a leap? And as soon as you master that, oh, my kid's walking now and I can figure this out, or they're crawling or whatever it is, there's a new thing and a new thing. And you're always reevaluating, and you think, oh, I finally can relax. You're like, nope, there's another level I've got to get to.
And I think that's the unique thing about pediatrics is that development will take, we have to do absolutely nothing. Development will kick in.
Yeah.
The rate at which it kicks in and how straight of a line or curved a line or zigzag of a line it takes, but development will happen. So what we're here to do is support that development, teach families how to support that development, and how to, if we need to, try to decrease that gap between where their age is and where they might be functioning at. But you're absolutely right. Kids are going to continue to grow and kids are going to continue to develop. And individuals, if once you've achieved those skills, some individuals are relearning, but for kids, you're learning for the very first time. Yeah. Oh, so there's never the stop of learning. And so when we're looking at activities and skills, you might be working on something for a brief period of time, and then you're going to support that family, and then you might have to see them back in 6 months or a year to maybe address another skill set, or because it's constantly changing. And I think in pediatrics, that's the hard thing, because you never, as a first-time parent, we take cues from our kids. Yeah. And so when our child isn't giving us those appropriate cues, it's hard as a parent to know how to push.
Oh, yeah, especially if you've never seen it before. A friend of mine who I was talking to about his son's autism diagnosis, he's like, I wish somebody would have told me that there were signs that I could, you know what I mean? And I think him and his wife, did it brilliantly. And I think they were able to catch it early enough. He's 3.5 or just about to turn 4. And so they kind of caught it 2.5, early on and so they were able to have good interventions and plans to help him associate things properly and have, better communication and all of those things. But he's like, no one tells you that this is a flag and sometimes depending on your practitioner, they may say just wait, and because again, every kid's different. And, my nephew didn't talk until he was 2.5, but when he did, it was full sentences. So he had a lot of telltale signs of oh, your kid might be on the spectrum, but then he wasn't. So it just to kind of put your point in there. It's every situation is different. Right. So you have to be aware of the flags. Some of us, again, I don't know what half the flags are until I've run through them crap.
True, but I think that's where families need to, the more we're around families, and we're also coming out of a period of time where we weren't allowed to be around anybody. Yeah. So the more that, we're around other families, the more that we can talk about things, the more that we can have our kids around other kids. It's a matter of just saying, how do I support my kid to do that? Yeah. And asking questions. It's not a bad thing. And there have been some changes with the CDC in terms of monitoring and how quickly do we jump onto intervention. And that can be kind of scary sometimes, because it's almost like if we don't talk about it at all, everything's fine. And so I'm of a belief where, we don't want anybody to have to come to therapy. We're not here trying to solicit business. We would rather monitor and then, move them on and give the right supports. But, for families, I think it really is it is a full-time job to understand kids and to understand your kid. But being able to have those places where you can seek out information, reputable sources, being able to not be afraid to bring those up and to push if you are concerned, because you are the expert. Parents are the experts. So please know that you are the expert. And so we're just here to support families.
No, I think that's beautifully said. Absolutely. And you can't drive it home enough that I've just got to use another story because I think it's so poignant. My niece is a very delayed walker. She was like, my son is 2. I think she's about to turn 2. And she could stand up and she had the strength, but she's a COVID baby. So she's never been around like other kids or anything like that. And all of a sudden, we go to finally visit my family's in the UK, and she sees this other small person using his legs. And she's looking at him and looking at me and looking at her baby brother. And then all of a sudden I get a video a few weeks ago, she's walking.
Wow.
And you're just like, then her mom was a late walker too. So it wasn't like a big surprise, but it was almost like just that thing of like, oh, here's another small being moving. Oh, maybe I should try that. Yes. And then she's just like off to the races now.
They are sponges. Anybody who has kids know how quickly they soak up the good, the bad, and the ugly that's around them. So, but it is true. I mean, their brains, if they are clued in and checking in with their environment, most things they are learning through observation. So we need to make sure our kids are observing. We need to make sure our kids are participating through observation, because that's where it starts.
Yes.
And from there, then they start to participate more. And so I think, to me, observation is one of those key flags, not a red flag, not a green or yellow. It's a key flag. Is your child observing what's going on around them? Because that means that they are soaking in what they're supposed to soak in for their age.
Oh, that's so funny.
And then they, in turn, output it.
My kid is hyper observant, so he will watch a situation before and see all, and then before he asserts himself.
Yes.
So he's always been like that since he was 6 months old and sitting up, and now he's 4.5, and he's like, I'm not sure this is the right thing for me. The other cool thing, because I could talk about my kid all day. Couldn't we all? Right? The other cool thing that I love about Brooks is you have adapted sports programs, which I think is absolutely incredible, and just so amazing. Can you tell us a little bit about them and what's offered?
Absolutely. So I'll start with the pediatrics first, because that is the program that I oversee. So the Pediatric Recreation Program was developed in 2016. Okay. And so the goal of it was really to promote socialization, recreation, and networking, community integration for families, whether you're in therapy, whether you're past therapy, at any stage. But looking at it in terms of what kids enjoy and what they like. Right. You guys know what they like. We take your input. But knowing what they like, but also when families can participate. So we developed really a schedule that's somewhat more extracurricular, that allows families to be able to participate after school, on weekends, in the evenings, but looking at what are those activities where there might not be anything in the community.
Right.
Or there might be something that parents are hesitant to sign their children up for. So a lot of times I used to hear all the time in the clinic, I want to get my kid into something, but I don't know what they're going to be appropriate for, or if this person's going to be able to work with my child, or if my child's even going to like it.
Right.
And we want, as therapists, we want our families to be connected and integrated with their community. We want them to practice those skills in a community setting. Please, that's our goal as therapists, is to practice that outside the therapy walls. But really, we were looking for, we need to provide a supportive environment that people can feel like is that transitional kind of environment to true community integration. So we designed a program that has lots of different activities. They occur year round. We operate seasonally. So every season, new activities and events are coming along. We have special events once a month, and that is, really family friendly. So the whole family is encouraged to come out.
Wow.
And then we did start a couple of years ago, actually right before COVID, adaptive sports. And so we kind of had, when we talk about the Pediatric Recreation Program, we have recreational activities, which, are really for those with physical limitations, those in the IDD community, those with social dysfunctions or social disorders, communication disorders. But then we also realized that the adaptive community was what we call the adaptive community, is activities for those with individuals with physical limitations or physical disabilities. So we have a very successful adaptive sports and recreation program. And that's open to anybody of all ages. And that started in 2007.
Wow.
And so that's been running successfully. It's a nationally renowned program, and we have very competitive sports teams. So knowing that, we said, well, we want to be able to start those kids earlier. You know, we have sports teams that kids have played on before. But it was one of those things where how do you funnel them in there? How do you attract them?
Yeah.
And how do you, create those schedules where families can know about it, learn about it, and be able to participate in it?
Yeah.
So we actually started some of our adaptive sports programs, which should help kind of gather those or help recruit and funnel in those athletes. And then if they'd like to go into, our other adult sports teams, because they're division specific, they're age specific, they can do that. One of our fantastic athletes who actually started at 12 or 14, he started playing with our adult team because that was before our program, the pediatric program, was around. So he started playing as a kid with our adult team and just went this year and got a full scholarship to Alabama for wheelchair basketball. So we are looking at sports that have a future, that have an opportunity for kids to really see themselves in roles and take on opportunities to where now their vision is much bigger.
See, I love that. I actually wrote a book about inclusion, because I would just remember, sports days when I was a kid, but like my favorite, it was like field day, race and da-da-da. And when I was in elementary school, like everything was separated, so whether you had an intellectual or a physical disability, you were probably in a different classroom. And one of my best friends' sister has been in a wheelchair like basically her whole life. And I was like, oh my gosh, she never got to participate in a field day. And I was like, well, how do you make it inclusive? Because a lot of these kids are capable. They just have to do things a different way. And our, school systems, not trying to slander them, is, I guess they don't have the capacity or whatever to create a more inclusive environment for some of these like sporting events. And so I just thought when I found that you guys offer this program that was just so brilliant, because there are so many kids who want to do so much and there's nowhere for them to go. So
they never thought that they knew that they liked something until they had an opportunity. And not everybody's going to like everything.
Right.
But I think it's always key that I tell myself participation looks different for everybody.
Yes.
So therefore we have to support participation at all different levels. That can be coming out and literally just being in a new environment. That can be actively, physically participating. That can be enjoying and appreciating in all the visual and auditory stimulation around that. So I think what we have to look at is inclusion is about participation, and we need to understand how participation looks for everybody. And then therefore we're always trying to do better at that. We're always trying to understand who we are serving and what they need and what they're looking for. And that's what we're here to deliver.
Oh, I love it. And so why is it important for Brooks to offer these services and programs to the special needs community?
Great question. Well, I think it goes, for a very simplistic answer, it is what the mission and vision of Brooks Rehabilitation is. It's about empowering individuals to live with a quality of life that is enjoyable to someone else. It's about finding what that quality of life is for someone, and that looks very different for everybody. But looking at, and of course, looking at healthcare in general, the healthcare industry is all about outcomes. Reimbursement is about outcomes. Looking at how people get paid and providers get paid are about outcomes. And everything is driven right now about what is the patient's experience, as it should be, because we're not here just to push a product. We're here to do something. We're here to serve someone else. That's the industry of healthcare. We are here to serve someone else. So we need to make sure that not only the patient experience is excellent, world class, as we would say, but it's also that we're showing outcomes that we're improving. And we have to look at what those outcomes, are, how we're measuring that. Are we measuring it just by their physical gains? Are there, mental or cognitive gains? Are we measuring it by their quality of life? And so when we look at our community programs and these unique programs that I think are very special to Brooks, we're providing that quality-based valuable opportunities for people that go beyond just what we can do here in this wall in this clinic, and truly about lifelong recovery, lifelong development of quality of life. And so I think that goes back to exactly the mission and vision of Brooks. But I think it's amazing to me when I think back now, being at Brooks for 16 years, all these community programs were started by clinicians.
Oh, wow.
They were all started by people who saw a need.
That's pretty cool.
Who said we need to do more and we need to do better. And so they were all developed by clinicians. And so they were, or people who work with patients. So to me, that makes me very proud to say, no, you've got people who are willing to go out on a limb, work very hard, and you've got an organization who's willing to support that. And I think that's the amazing thing, is that we're not done. We are always evolving. We're seeing opportunities, and we're trying to stay ahead of the curve of healthcare, because
pioneers.
Absolutely. Innovation is one of our values. Yes, that's of course why we're here. You can't, and that's why you need good competitors around you. You're not going to stay sharp unless you have really good competitors around you. So that's constantly what we're looking at in terms of how do we set the standard, but how do we try to do it better than everybody else.
That's awesome. So you think parents should be aware of before starting any therapies or becoming a patient at Brooks?
Well, I said it once and I'll say it again. You're the expert. So you know your child best. I think it's important that anytime you're thinking about, inviting or asking for support, whether that be therapeutic support, medical support, educational support, I think you need to make sure that you know what you bring to the table as a parent.
Okay.
You're not going to know, you're not going to go in and speak the language of a psychologist, a therapist, a physician. You're not going to, but you're going to have a unique perspective that none of us can understand. And so I think it's important that a parent comes in and knows what they're bringing to the table and is confident with that, because you are bringing a lot that we as professionals need. So I encourage you and all families to say, you're the expert. You advocate. You have to advocate for your child. If you're not certain, then you need to ask questions. If you're not certain, you need to ask people. You need to find resources. But I think once that journey really starts, it's about recognizing that it is a relationship.
Yeah.
It's a relationship, and a relationship takes time and it takes communication. And I really implore families to, be participants, active participants in that therapeutic journey. But know that, we don't necessarily know which direction it's going to head.
That's a really good point.
We know how to support, and we know what levels of support it might take, but we're not mind readers. So what we're here to do is try to help support, where that child is, what your values and goals and priorities are, and then how to take them. We're not taking every child through this developmental milestone to hit them all. That's not always going to happen for every child. And so we really have to look at each little body, each little system as a unique organism, and how do we support that organism in their environment and with the relationships that they have. So I think for families, it's knowing that that's a relationship that is a trusting relationship. We're here for the better of the child. We're here to support you. But really coming to the table to, if you don't know, we are happy to give information where we can. If we don't know, we will, if you don't know, bring that up. We're not here to shove a prescription down your throat, and we're not here to give you, these are the exercises you're going to do. And so it's going to look different for every patient. But we are trained specialists. So we do have a lot of tools in the toolbox to be able to offer. And we're going to try everything we physically and mentally know what to do to try to support your child. So just know that it's a journey. No matter if that journey is 8 weeks long or if that journey is 8 years long, it is a journey. And so I would say everybody has their role and everybody has their specialty that they're bringing to the table. So please, parents, know that that's what we're here to do.
Well, I think that's so important is because you might think that a care plan could look one way, but then, this could be taking longer. They could be excelling at a different, and then you have to bring in a different therapy or a different approach. So, I mean, my next question was, how do you cater? But you already said it, like you're doing all these different things to figure out what sticks and what's working for them to get them to the next level.
Well, and we have, there is science behind what we're doing. It's not just throwing darts at a wall. There are prognoses that we measure. There are diagnoses that we can anticipate, limitations that are going to come up. We know how to assess developmental stages and developmental skills. But I think, like you said, we're constantly evaluating and reevaluating that plan of care. So we are going to do our initial evaluations. We're going to use the treatment approaches and the treatment strategies that we feel are appropriate, but we are always going to be looking at, is that working? Because we're not going to continue doing something if it's not working. But just because we change something doesn't mean that we don't know. It's a matter of figuring out, okay, is that child responding or is that family responding to what we're trying? And if they're not, then how do we pivot? And pivoting is part of the process because remember, development's going to take its own track. So we're trying to, support the train as it sometimes bumps around and derails and trying to, figure out, go the right speed, the right conditions, the weather conditions, figuring out which direction to head. So I think that's really what it's about is knowing that it is a constant evaluation process that we are doing. It's not just said in one
right. Yeah, I like that. So the other thing that you guys offer is an adult program, a program for adults with developmental disabilities. Can you discuss that a little bit?
Yeah, actually, it's fairly new, and it was really exciting when it started. It's actually in our inpatient hospital right now. So it started in our inpatient hospital probably right before COVID. And what we were seeing is we have, we service pediatrics. We have a pediatric specialty team in our hospital, and they only do pediatrics. I mean, that is their specialty. That is their training. But what we were starting to see, and we've always seen them at times, but especially before COVID, we were seeing individuals, and through COVID, we were seeing individuals who are adults who have developmental disabilities. So as all of our children that we're seeing who are in probably that IDD community, the intellectual and developmental delay community, they're going to be adults. And so we as a society and a community need to be able to support those individuals as they age, as they become more independent. And so when you have a developmental disability and now you've had a traumatic injury or a surgery, that's a unique set of circumstances that you have to understand how to communicate with an individual with developmental disabilities, considering factors or, possible environmental and familiar considerations, and how to work with that family to set appropriate expectations. So we have a great story on our website, which was about an adult diagnosed with autism spectrum. Oh, wow. And so he had a traumatic injury, and it was part of his recovery that they had to really customize. How do we communicate with this adult what we want them to do in therapy? How do we get them to adapt and transition to 3+ hours of therapy in the hospital? And then all of your outings and such. How do we communicate and work with the mother? And really it was working through the mother, because the mother was the expert of how to support her son after discharge. Wow. So, I mean, this team is really unique because they know how to work with developmental disabilities, whether you're an adult or a child. But now being able to service that population specifically, it is a very individualized, customized program that really it's assessing what the individual's needs and interests are, and then being able to build a therapeutic plan around that. Whoa. Because if there's not that motivation, you're not going to get any outcomes. You're not going to get the outcomes you want.
No. And get them to a place where they can be successful in their day-to-day existence.
And that recovery might have a different prognosis. It might take a slightly different time frame. And we have to recognize that it's not going to be, if we're seeing patients anywhere from 2 to 3 weeks in a hospital and then discharge. Yeah. Someone maybe with a developmental condition or diagnosis might have a different time span or timeline in those 2 to 3 weeks in terms of what what recovery looks like before discharge. So then we have to put in what are additional supports and services outside the hospital. And that's really where our great transition team is so effective, because they're the ones who are helping to start that. If they had them before, great. But now you really have a dual diagnosis. You could have a traumatic brain injury as well as maybe someone diagnosed with autism spectrum or Down syndrome.
See, that was the word I was looking for earlier, intellectual delay. Like, that's the appropriate terminology, and I couldn't find the word. I hate that. Oh, is there anything else we didn't know we needed to know about supportive therapies and rehab?
Oh, I think, I was going to say, that's a 45-minute question. I think it's a matter of recognizing that there's going to be different levels of support as your child ages. And as an individual, goes through their journey. And so I think it's always looking at what might be needed now. Is this, and I'll just use this for an example, I might start with early intervention, and that looks a certain way because they have a certain model working in the home. That might evolve to, a school-based program, and there might be school services in the school or not. There might be additional outpatient services that child could be eligible for, and you can get both. And then maybe outpatient, there's the determination of which service sometimes in which environment is better supportive for that child, and constantly evaluating where's that support needed. And as that child gets older, it becomes more educational support. And how do we support that education, and what professional? So I think we have to always be looking at where's that child in their development, and what professionals do we need to support that development. So I think that's where the family needs to help us figure it out. But no, we are here to support. We all of our therapists, as any therapist, love what they do. And so, we're here in the community. We have free screenings. We are here for skilled therapy with, physician referral. And then we have our free community-based programs. So we're kind of here for anything you need.
And anything and everything. Now, but where can people find you, like online or social media?
So if you go on our main Brooks website, brooksrehab.org, you can click on services, and all of our services will come up there.
There's a lot.
Very overwhelming. If you have questions specifically, you can go to pediatrics@brooksrehab.org.
Okay.
That's a great funnel, like a good catch-all, which can then say, okay, do I need to go to outpatient? Do I need to go to community? Do I need inpatient? I mean, inpatient is usually something that no one is looking for. So unfortunately, it's never something that people want to be referred for. And so usually that's coming from a medical provider. But we do have a great listing of our outpatient clinics there. We have 10 outpatient pediatric clinics from Jacksonville all the way to Daytona.
Wow.
So there's pretty much anything available in your immediate vicinity. But definitely that pediatrics@brooksrehab.org is great. And then if you're looking specifically for pediatric recreation, it's pediatric recreation at brooksrehab.org. And I'm happy to provide my information if people have questions.
You sounded like one of those answering machine voices.org. I love it.
It's my QVCs.
Right, exactly. Well, I'm the mom who knows now. My name is Brianna. This has been Megan talking with us about Brooks Rehabilitation and all of the incredible services they offer. So now you know where to find them. And until next time, have fun learning all the things you didn't know you needed to know.